Dr. J.P.S. Sawhney, Chairman, Department of Cardiology at Ganga Ram Hospital, New Delhi. Today, I'm going to give a talk in CSI on the topic that time has come to initiate combination therapy for intensifying lipid lowering in atherosclerotic cardiovascular disease patients. Dear friends, as you know, that recent ESC guidelines have suggested that for every patient of atherosclerotic cardiovascular disease, one should lower the LDL cholesterol to less than 55 milligram. And if a patient gets a recurrent coronary event within 2 years, there is a suggestion that to reduce it to less than 40 milligram per deciliter. But what happens in real life clinical practice, the data which has come from EuroHeart survey and also from Digimed study by Dr. Kaushik Ray have shown that only less than 30% of the patient with high intensity statin could able to achieve these levels. And when we have used a combination treatment with ezetimibe or PCSK9 inhibitor, we could able to achieve the LDL goal in more than 90% of the patient. Now, guidelines have suggested a stepwise management for this population. They have suggested that you always start with high intensity statin, wait for 1 month, and repeat the lipid profile. And if the levels are not reached below 55, then add ezetimibe to this population. And then again wait for 1 month, and then repeat the lipid profile to add the PCSK9 inhibitor if it is needed. So with this is a 3-step management strategy what they have suggested. But as we are also aware of the fact that the statin only lower, in high dose of statin only lower the LDL cholesterol by 50%. And if we add ezetimibe, then we lower LDL by 65%. And we add PCSK9, then it is more than 85%. Now, in view of this, what we have experienced that in majority of the patient with atherosclerotic cardiovascular disease, those who present as chronic coronary syndrome or acute coronary syndrome, if they have a LDL of more than 120 milligram, keeping in view that this high intensity statin will only reduce by 50%, then at best we will able to reach 60 or 65, which is not the ideal goal. So keeping in view this fact, it has been now discussed recently in the European Atherosclerotic Society meeting that there was a good suggestion or recommendation that why not start with the combination treatment rather than having high intensity statin, start with high intensity lipid lowering therapy, thereby saying that high intensity statin along with ezetimibe as step 1, and then wait for 1 month to look at the guide to the LDL, and if it is not achieved, then add PCSK9 inhibitors. So with this method of starting as a combination treatment, probably we'll able to achieve the goal of LDL in significant number of patients. Otherwise, we'll miss that target for a longer period of almost 3 months. And for that reason, that's why the new what we say mantra has come now. The lower the better, earlier the better, longer the better, but finally we say now together the better. So combining the lipid lowering drugs will able to achieve the guidelines recommendation of less than 55 or 40 in our patients. Thank you very much for listening to this talk. Thank you.